You are welcome to my channel. Thanks for visiting. Today, we'll be talking about syphilis, and the focus will be on signs and symptoms alone. Without further ado, let's go. Let me just quickly take you through what you are likely going to meet here. The signs and symptoms will be in stages. The stages can overlap, but the stages will clearly define the severity of syphilis and may not necessarily follow a fixed pattern because it doesn't have to follow a specific timetable. For example, someone is already infected, but there may be no symptoms for decades. So for me to say that primary syphilis will likely occur when there is canker in 3 weeks post contact doesn't mean it will necessarily be so in some other individual. But when that is the case, we define that as primary syphilis. It may be unnoticed, that is, the canker may be unnoticed and could be painless, could heal within 3 to 6 weeks, associated with regional lymphadenopathy. Don't worry, I'll talk more about that in a bit. While the secondary syphilis will occur in weeks after the primary canker would have been formed or seen or will be healing. Then this stage, the secondary syphilis, will involve formation of rashes that could be from trunk to the entire body, affecting the palms and soles, but will not be itchy. Also, we can reach a stage here with alopecia. Some will have muscle pain, and of course, the syphilis will now enter the system, systemic syphilis here with constitutional symptoms, fever, and the rest. Then the throat could become swollen here, and then the lymph node will no longer be regionalized. Remember, under the primary with canker, the lymph node alignment will be regionalized, but under secondary, it will go beyond that. And one-like sores could be found in the mouth, in genital area, and so on. Without treatment, the above can relapse and overlap and continue to be occurring, and the secondary syphilis can last up to 1 year. Now, early latent. When something is latent, we are trying to say that nothing is happening, but it has the capability of happening after some time. So at latent syphilis, there won't be any symptom, so it is hidden here and can be there for years. So that is latent. Late latent could even be there for as long as 25 to 30 years. Yeah. And then can progress from early latent to the next stage, which will be late syphilis. Primary, secondary, and early latent are all early syphilis, while tertiary and late latent will be late syphilis. So from latent could progress to tertiary syphilis. In tertiary syphilis, this is going to occur in about 1/4 of all affected patients, and specifically, we'll be dealing with complications that is affecting the heart, like aortic insufficiency, and then could be dealing with gumatose formation. Don't worry, I will delve into that more later on. Then still on latent and syphilis, late latent now, that is after the early stage has been passed, it's been there for a long time, 25 to 30 years. But in the case of neurosyphilis, well, this could occur at any stage. Yes, at any stage. All that is required is that the causative agent, treponema pallidum, is in the circulatory system and it has reached the brain or the spinal cord. In fact, syphilis affecting the eyes, the ears, the brain, the spinal cord will be grouped together as neurosyphilis. Still on the first note to take care of before listening to this presentation fully will be a slight touch on possible complications. And let me start with congenital syphilis, because this is a very big issue. When a pregnant woman is down with syphilis, might be unknown to her. That is why it is compulsory to screen for syphilis first day at the antenatal clinic. There may be miscarriage, yes. And when there's no miscarriage, there may be intrauterine growth restriction. If that is not the case, there may even be intrauterine fetal death. And if the woman is fortunate to carry the pregnancy to term, there may be stillbirth. And to those who even give birth to the babies alive, there may be neonatal death. Can you see this is a big issue? And another problem is the chances of having HIV is pretty high when someone is already down with syphilis. As a matter of fact, we screen for HIV in anyone that is positive for syphilis infection. Now, cardiovascular system. The heart valves could be damaged, leading to aortic insufficiency and aortic regurgitation. The ascending aorta could be destroyed. There may be aneurysm of the aorta, and that could lead to aortic dissection. That may lead to sudden death. As a matter of fact, when we are dealing with tertiary syphilis, we'll explain further about that. Then let me touch briefly on neurosyphilis, which could occur at any stage in the disease stage. So here, headache could be the presentation, the headache that they don't find the cause for, right? There may be stroke, there may be meningitis, there may be hearing loss, there may be visual problems, in fact, there may be blindness, and there could be dementia. Pain and temperature sensation could drop, and tape dorsalis might be a problem. In fact, there may be sexual dysfunction and even bladder incontinence. The fewer complications will include the canker that may heal on its own, and bones like gummatous formation that could be pig on the skin, the bones, the liver, and these may disappear on their own with or without treatment. But when you are even treating yourself for something else entirely, but you are using the correct antibiotics like penicillin if you are not allergic to it, or there's desensitization, or you're using cephalosporin, those ones could disappear without you even knowing you have syphilis. As we proceed, we'll be running into so many non-specific signs and symptoms when it comes to syphilis. That is why I have written it down. It's all over the map. It's all over the map. It's not so specific most of the times. So, but certain dermatological lesions coupled with the history and serological investigations will help us arrive at definitive diagnosis for sure. Some people can have syphilis because it might be asymptomatic. They will not even know, even the canker would have come and be healed on itself without any antibiotics. Or imagine a situation where someone is down with syphilis but unknown to him or her, and for another reason entirely, he or she has been given penicillin. And the penicillin is handling whether the pneumonia or any other condition that he or she is using the antibiotic for, but at the same time dealing with the syphilis at the background. Imagine that. So it's just like that, and can be in you for several years. And for several years, you won't know, and there'll be no manifestation at all. So that is it. So we have to follow these signs and symptoms very closely. Now, definition of certain terms will continue. The first term, as far as signs and symptoms of syphilis is concerned, will be the chancre. Here, we'll be dealing with the first feature of primary syphilis. This is where the journey starts from. This is a painless ulcerative lesion in most cases, fair to say, but sometimes it could be painful under certain conditions. If you look very closely, it will have raised indurated margin that will be very thick and very hard. And it will be found at the site where the causative agent, Treponema pallidum, had gained entry into the individual we are dealing with. So it's going to be found at the site of Treponema pallidum inoculation. If you look very closely at the regional lymph nodes, it will be enlarged. So it's associated with regional lymphadenopathy. It contains fluid that is pretty rich. Rich not in what we think we want, but rich in something that may help us in making definitive diagnosis. It's going to be rich in the spirochete, Treponema pallidum. If you swab that, you can have your dark field microscopy done. At the same time, that is a factor in transmission. Sure. So people can transmit transmit syphilis causative agent without even knowing that they have it, because the chancre is painless and it's not going to give them any trouble. It may heal on its own, even without any treatment, within 3 to 6 weeks. But let me drop this here. When people have this and they have another reason to take antibiotics, either penicillin or cephalosporin or even macrolides, and particularly if they take it for maybe some few days, it will handle whatever they are treating it for, like pneumonia, but they may be dealing with the syphilis at the background also. So that is why many times many people will have syphilis and it will go without knowing at all. It will appear after inoculation within 3 to 4 weeks. Most authorities will put it as 21 days. It could be found on genitalia mostly, but other sites are not immune to it. Could be found at anus, the lips, the pharynx, depending on the particular site through which the causative agent got into the system of the affected person. It is not multiple many times, but maybe multiple in immunocompromised patients, particularly those with HIV/AIDS. So it is not systemic yet, it is localized. And that is it with chancre. Still on definitions, let's check condyloma latum or condylomata lata. Then we'll compare that to condyloma acuminata. This first part, condylomata lata, is about syphilis. Is what's like. That's why it's been confused with acuminata, which is genital warts that is caused by human papilloma virus. So this condyloma lata is about syphilis, is benign. It's a benign growth found in early syphilis, specifically secondary syphilis, not in primary syphilis, but in secondary syphilis, not in late syphilis, in early syphilis. Okay, it is benign. We don't expect it to give us anything horrible. It's painless. And of course, it's a skin lesion. It retains the color of the skin where it is found, or sometimes could be lighter than the regional skin that is become hypopigmented. It could then, like I said, is a growth, right? Like wax. It's wax-like. That is why it is being confused with acuminata, particularly if it is found in genital area. Okay, it could be found around the mouth also, not only in genital area. It could be gray to white in appearance. So that is that about condylomata lata. Now, condyloma acuminata is genital wax that is formed caused by human papilloma virus. But it depends. Well, don't let me dive into that. We will have another session for human papilloma virus later on, or cervical cancer, as the case might be. Still on definition of terms, let's consider gumas or gumata. They are the uncommon nodular granulomatous lesions that are rubbery with inflamed fibrous capsule and necrotic center. Let me quickly state here that when we find gumatous lesions in anyone with syphilis, then we've moved away from primary syphilis to tertiary syphilis. So it's not early part of the syphilis, it's the late syphilis, okay? It is common in people with decreased immunity, maybe as a result of HIV/AIDS, malnourishment, chemotherapy because of the cancer, or someone has chosen to be taking steroids indiscriminately or on disease-modifying anti-rheumatic drugs. Anything that can shut the immunity down can lead to granulomatous formation. It is mostly located in internal organs or the viscera, but could also be found on the skin and the bones. So it is irregularly shaped or spaginious shaped, might be small, and sometimes could be large. Because this is a granulomatous lesion, it could be found in other conditions outside syphilis, like sarcoidosis, rheumatic fever, cat scratch disease, histoplasmosis, schistosomiasis, tuberculosis, leprosy, and the list goes on. But with the help of serology, we'll be able to do serologic tests and make diagnosis of syphilis. So when we pick this, then it is no longer something new. It is tertiary syphilis. Now, finally, on definition of terms, loose maligna will not be fully defined right now, but you just jump to the next slide. You will find a separate presentation on loose maligna, and that will explain everything. So don't let me waste your time about that. Loose maligna, meaning venereal plaque from Latin, and is the formal name for syphilis. It's a severe form of secondary syphilis. The type of patient will be severely immunocompromised patient, particularly those with HIV/AIDS, and might be with chemotherapy or steroids or anything that could suppress immunity. But it could be found in immunocompetent patients, although very rarely so. It is characterized by non-resolving skin ulcerative lesions, also with nodules, pustules, crusted papules, and plaques. It is located or could be found on the skin, mucosa, lymph nodes, liver, and spleen. Other names for it will be malignant syphilis, syphilis malignant precox, or rheumatoid syphilis. Thanks for listening. Remember to subscribe to my channel. From this point on, I'll be addressing the signs and symptoms specifically based on certain factors that will group anyone with syphilis into categories. Category A will include all cases under early syphilis, and that will include primary syphilis, secondary syphilis, and early latent. Category B will be about late syphilis, where we'll be talking about tertiary syphilis and late latent syphilis. While the last category will be category C, where we'll be dealing with neurosyphilis. Category A, remember, it's all about early syphilis, right? Let's start with primary syphilis. I will not waste your time again because I have defined everything about chancre. So I will just skip right now so that the next slide will explain everything about primary syphilis that is totally based on chancre. Okay, can go. Now, definition of certain terms will continue. The first term, as far as signs and symptoms of syphilis is concerned, will be the chancre. Here, we'll be dealing with the first feature of primary syphilis. This is where the journey starts from. This is a painless ulcerative lesion. In most cases, first say, but sometimes it could be painful under certain conditions. If you look very closely, it will have raised indurated margin. They'll be very thick and very hard. And it will be found at the site where the causative agent, Treponema pallidum, had gained entry into this individual we are dealing with. So it's going to be found at the site of Treponema pallidum inoculation. If you look very closely at the regional lymph nodes, it will be enlarged. So it's associated with regional lymphadenopathy. It contains fluid that is pretty rich. Rich not in what we think we want, but rich in something that may help us in making definitive diagnosis. It's going to be rich in the spirochete, Treponema pallidum. If you swab that, you can have your dark field microscopy done. At the same time, that is a factor in transmission. Sure. So people can transmit it transmit syphilis causative agent without even knowing that they have it, because the chancre is painless and it's not going to give them any trouble. It may heal on its own, even without any treatment, within 3 to 6 weeks. But let me drop this here. When people have this and they have another reason to take antibiotics, either penicillin or cephalosporin or even macrolides, and particularly if they take it for maybe some few days, it will handle whatever they are treating it for, like pneumonia, but they are maybe dealing with the syphilis, at the background also. So that is why many times many people will have syphilis and it will go without knowing at all. It will appear after inoculation within 3 to 4 weeks. Most authorities will put it as 21 days. It could be found on genitalia mostly, but other sites are not immune to it. Could be found at anus, the lips, the pharynx, depending on the particular site through which the causative agent got into the system of the affected person. It is not multiple many times, but maybe multiple in immunocompromised patients, particularly those with HIV/AIDS. So it is not systemic yet. It is localized. And that is it with chancre. In secondary syphilis, we are going to find some changes here that will be different from early syphilis. This is likely going to start in weeks to a few months after the primary syphilis, that is, after the development of the chancre. And here we'll be battling with loss of dermatological signs and constitutional symptoms. Let me quickly delve into the physical examination and the signs we are going to pick. We will pick rashes. That is characterizing secondary syphilis the most. Rashes. The rashes here could be all over the trunk, but look at the palms and soles very well. Then there may be drop in width, and then when you check for the lymph nodes, it's no longer going to be localized to the region of the chancre like a primary syphilis. No. This time around, it could be beyond one region like epitrochlear, axillary, inguinal, or femoral. And inconsistency is likely going to be firm and rubbery. It is expected to be non-tender, but could be slightly tender. Let me go back to the rashes a little bit. Like I've said, is the commonest characteristics of this stage. Appearing on the trunk and extremities could be pustular or papular, and there might be mucosal patches. Still, under dermatological presentation will be columata lata, and that will be around the region where the primary canker had developed previously. Remember, I have a separate presentation on columata lata, a separate slide, so you can just rewind back to get that. Still on dermatology, besides the mucosal patches, columata lata, and the rashes, you can have alopecia. And in this case, it is called moth-eaten alopecia. Luis malignant could be present here. It is a feature of secondary syphilis. But The difference here is that it's going to occur in people with severe immunocompromised status, like anyone having syphilis, having HIV/AIDS combined can have Louis malignant. You can reverse back to that presentation on Louis malignant also. It's going to be found in secondary syphilis, not in primary syphilis. So, many people would have developed chancre in primary syphilis and they won't even remember, but we're now dealing with systemic syphilis. So, some of those spiral shift, Treponema pallidum, had gained entrance into the system. Now in the circulatory system, moving around the entire body. Then the other feature here is secondary syphilis can resolve on its own, even without treatment. And there's likelihood of relapsing syphilis at this stage, and that can occur even up to 5 years post first episode of the primary cancer. Now, let's delve into the constitutional symptoms. Remember, we have moved from localized early syphilis with cancer alone. Now it's systemic illness as certain. So there may be fever, malaise, anorexia. Some will have pharyngitis or sore throat. Some will have syphilitic hepatitis and can affect the bone, giving us joint pains, and that could be as a result of synovitis or periosteitis. Even gastrointestinal system is not spared because there may be gastrointestinal ulceration, and even the renal system can develop glomerulonephritis. The ocular system is not spared, and like when we get to category C with neurosyphilis, neurosyphilis might set in here with headache already and even meningitis, but we're still at secondary syphilis. And then the journey has not ended because this is systemic. The ocular problem might be so serious that the individual can develop anterior uveitis, or in some other people, posterior uveitis, and in some cases, it can spread across, giving us panuveitis. That will also be granulomatous. So, secondary syphilis, though category A, which is early syphilis, is systemic problem, is systemic illness. Under early syphilis, which is what category A is all about, now finally in that group is latent syphilis, early latent syphilis. In this case, Treponema pallidum is in the system. Serological investigations could be done and pick the antigen antibody titer, but there are no symptoms. Yeah, no symptoms. Serological testing can establish that there's no Treponema pallidum, but no symptoms. And this can occur early in the cycle, and the early that I'm talking about right now is within the first year of infection, within 1 year, within 12 months. Now, category B, we're talking about late syphilis, and we'll be touching tertiary and late latent here. Late in the sense that it is no longer early syphilis. So, the canker has come and healed, and what has happened after? Systemic problem or still localized problem? Find out. So, as late as more than 1 year to up to 35 years, then syphilis can still show up. After more than 1 year, up to 35 years post primary canker. It may not be with experience of primary syphilis or secondary syphilis, meaning the individual might have not passed through everything we've talked about as per primary syphilis, or they did, they couldn't even remember that it existed. So they might have passed through the canker and they didn't even know until it has disappeared on its own. They might have passed through secondary syphilis, even with the rashes that is not pathognomonic per se, alopecia, constitutional symptoms, even affecting the gastrointestinal system, blah, 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 and they won't even know that it is secondary syphilis. So whether they have experienced that or not is immaterial. But what is important is that from the primary canker after inoculation, the treponema pallidum has remained in the system till now. And the now that I'm talking about at this stage is greater than 1 year up to 35 years. So the systemic illness can affect any organ. But when it comes to tertiary syphilis here, the emphasis will be on cardiovascular system and glomerulus formation. Yes. When the cardiovascular system is involved and glomerulus are formed, I won't go into that again because I have a separate slide already where I've explained everything about glomerulus the other time. So when we have both, then we are dealing with tertiary syphilis under late syphilis. Now, let's delve into the cardiovascular system affectation more. There might be trouble with ascending aorta. So with inflammatory process going on, aortitis, there may be aneurysm, aortic aneurysm leading to aortic dissection. And the valves could be affected, giving us insufficiency and regurgitation. In fact, some will pick newly formed murmur as the clue to the presence of syphilis. Unfortunately, it's going to be late syphilis already. And like I said, I won't go back to glomerulus formation anymore, but another system that could be affected here is central nervous system. We will go into neuro in a bit, and that will occur likely even greater than 2 decades. It can occur between 25 and 30 years after the first encounter with the syphilis, after the primary canker. Now, latent. Remember, we've talked about early latent the other time, that serology could pick that antibodies are already produced here when you select a particular antigen to react, then you are not picking any signs and symptoms. But how will you know that it's late latent? Why is it not early latent? Early latent will point to the time that the canker was formed. And if you're able to get that and is within the first 12 months, within the first year, is early latent. No symptom, serology is speaking in, the canker was formed within the last 12 months. Now, late latent, serology is speaking in, no signs, no symptoms, but the canker was found in this man or woman more than 1 year ago. Primary canker was more than 1 year ago. Another situation when you're going to label this that, it is late latent, is when the patient can't even tell us that he or she knew that primary canker was found in the year so. So when the time of the primary canker cannot be determined, then we will just write it to be late. Now we're rounding up the last category, neurosyphilis. I will just brush through this because I'm going to have a full presentation on neurosyphilis separately later on. So for now, neurosyphilis can occur at any stage of the infection. So be it early or late, be it now secondary or any time, neurosyphilis can occur. Now, early neurosyphilis can be asymptomatic or symptomatic, and it can present with meningitis that will present with high level of white blood cell count in cerebrospinal fluid with high level of protein, and maybe stroke with headache of unknown origin, and some will be down with ocular problems. Visual acuity can be down, decreased visual acuity, uveitis, and even blindness. Otologic affectation may lead to hearing impairment, even deafness. So when syphilis is affecting the eyes, that is ocular syphilis, or is affecting the ears, otologic syphilis, that is regarded as neurosyphilis. And with that, the treatment will be like that with aqueous penicillin G, 3 to 4 million units given intravenously every 4 hours, or 18 to 24 million units as continuous infusion daily, or for 10 to 14 days, as the case may be. Now, that's that about early neurosyphilis for now. There'll be a separate presentation on neurosyphilis generally. And lastly, still on neurosyphilis, like I've said earlier, can occur at any stage. Now, let's talk about the late just briefly. When it is late neurosyphilis, then the brain and spinal cord combined are suffering. There may be dementia and generalized weakness, generalized paralysis. Taves dorsalis. Yes, Taves dorsalis. Watch my channel for a full presentation on that very soon. And there may be meningomyelitis. With that, I've come to the end of signs and symptoms of neurosyphilis. It's time consuming, but it was. Thanks for listening. Please remember to subscribe to my channel. I appreciate it.